Hi, so my name is Amanara Fisa, and today we will be evaluating the image of the forearm, which is, if you can see here, uh, the structure that we can visualize here is the olecranon, and then the second one is coronoid process, and the radial head, radial midshaft, ulnar midshaft, and the radial styloid is can be visualized here. So it indicates that the projection is in the epiforearm. And then for positioning, to indicate that uh, to indicate that the image is taken with a correct positioning, we can see that the radial styloid is demonstrated in a profile laterally, and then the superimpositions of the metacarpal bases and the radius and ulna is minimal, and the radial tuberosity is demonstrated in profile medially, and the first one is the radius and ulna is run parallel to each others, and ulnar styloid is projected distally to the midline of the ulnar head, and the olecranon process is situated within the olecranon fossa, and the coronoid process is visual on the end, and the forearm is C at the midpoint at the center of the exposure field. So the wrist and the elbow joints and the forearm soft tissue are included within the exposure fields. And then last but not least, we can see that less than one eighth of the radial head is superimposed with the ulna, indicates that there might be a slight rotation. Hence, the positioning is correct for me, but it's rotated externally because the radial head and the radial tuberosity superimpositions with the ulna is less than 0.6 cm superimpositions. And then the second one is alignment. So first of all is the alignment between the X-ray tube and the cassette is correct because the superior, inferior, and both lateral border distances is equidistant. And the second one is the alignment between the X-ray tube and the patient is correct because the central ray is centered at the center of the part. And the third one is the alignment between the patients and cassette is correct. It is because the center of cassette is aligned to the center of the part. So in the forearm projection, the centering point is the midpoint of the forearm. Hence, there is no corrections for the alignment needed because the alignment is already correct. And then we will move further to the collimations. So if you can see on the image, at the superior border it includes the wrist, and at the inferior border the elbow is included, and at the both lateral border the skin margin is also included. Hence, the collimation is correct because all the required structure is visible on the image. Last but not least is the exposure. So first of all, the KBP use of a 70 kilo voltage power is adequate for the penetrations and radiographic contrast. This is because the bony conjugal outline of the structure of the thin structure, which are the radius and ulna, and the bony conjugal outline of the thick structure, which is the radial head, can be visualized. And then the milliampere second is also adequate for the detail and density. This is because the bony trabecular pattern of the thin structure, which is the radius and ulna, and the thick structure, which is the radial head, is visualized on the image. So there is no changes needed for the kilovoltage power and the milliampere second because it's already adequate to produce a clear image. And then marker, we can see that there is a marker placement on the left side, which is the left anatomical marker at the left upper side, and it is not also superimposed with the region of interest. So the marker placement is correct. And we can move further to the aesthetic. I think the film size that they use is 35 by 43 centimeters, which is suitable to demonstrate all the structure of interest. So lastly is name. There is no patient's information labeling, such as the patient's name, ID, date of examination, place of examination. All the information that is important is not present on the radiograph. Hence, the radiograph should put labeling that is not superimposed with the regions of the interest at the lower sides of the cassette. So to conclude, I think the image is accepted because there is no major or severe error while producing this image.